Hi, I'm Jennifer Briggs, a licensed acupuncturist with Briggs Health LLC. I'm located in Coos, Oregon, and today I am talking with my colleague Nitya Eisenheim, a naturopathic doctor who practices in Greenfield, Massachusetts. She's an expert in Lyme disease, and I really wanted to talk to her today because that's a disease that has been very prevalent in the northeastern United States for many years, but it's just now in the last few years starting to show up in some of the western states as well. So I wanted people to know what they should look for and how it can be treated. So Dr. Eisenheim, what is Lyme disease?
Yeah, thanks for having me here today. So Lyme disease, we also have a umbrella term called tick-borne illnesses, because you can have a lot of different pathogens that you pick up, a lot of different things, bacteria and viruses that you can pick up from a tick. So Lyme disease or tick-borne illnesses are kind of a grouping of infectious disease that you basically get from getting a tick bite. And as I was saying, the main pathogen, the main bacteria that people are familiar with are the Borrelia burgdorferi, and that's sort of the first bacteria that was identified that was causing Lyme disease back when it was identified. I forget the year, the date exactly. And yeah, but you can also pick up many other pathogens, bacteria and viruses, for example, anaplasmosis, babesiosis, Bartonella, and some viruses too, like Heartland virus, that a lot of people aren't aware of, that you can actually, some of the ticks can transmit that. And they're really different based on where you live, but in Lyme endemic areas, up to 50%. And I think, where we live in Western Massachusetts, it's probably more like 75% of the ticks are carrying, some type of pathogen that you can get sick from.
That's a lot.
Yeah.
75%.
Yeah. Yeah. Yeah.
What are the main symptoms that somebody with Lyme disease will experience?
So when you just kind of are contracting Lyme disease, or you just know that you had a tick bite, or you were out hiking or gardening or something like that, the symptoms are much more obvious. They're usually pretty sudden and acute. The classical symptoms that you'll see kind of in a textbook, or if you look online, are fever, joint pain, rash called the bullseye rash, where it's kind of red on the inside and then there's a circle of white and then another circle of red around that. Those are and joint pain, and those are sort of the classical symptoms. But according to ILADS research, which is International Lyme and Associated Disease Society, you can get so up to 30% of people don't experience any joint pain, and I think it was 30 to 60% of people do not notice any rash, and up to 50% don't remember reporting a tick bite, that they found a tick bite at all. But that's, what we call Lyme the great mimicker. So really you can have any symptom with Lyme disease. And that's part of what makes it tricky for a lot of doctors to diagnose it. You can have, the classical things like the joint pain and the rash, but I've seen severe mood swings, severe digestive upsets, mostly more towards diarrhea. But sometimes when people are on long-term antibiotics, there's also constipation, but that's more a side effect of the treatment than the illness itself. But you can have nausea, headaches, back pain. This one time I had a patient that came in when I was working in Vermont as a primary care doctor, and she just thought she had pulled her back out. But she came in and she had severe mid-back pain. She had a rash on her thigh, but it wasn't a bullseye rash. So again, you can get any rash at all, really, with a tick bite and with Lyme disease. And
So would these symptoms usually come in right away, Nitya?
Yeah, it's usually pretty sudden and acute for most people. Some people have a dormancy period, but most of the time it's pretty obvious and it's pretty acute once you start noticing the pattern. But with her, she thought that she threw her back out, but she was like, she had nausea. She was like laying on the ground. She couldn't really it was obvious like there was something more going on. And so immediately was like, you have Lyme disease, and, prescribed her doxycycline, which is the main antibiotic that's used for treating Lyme,
Oh,
and
okay.
other herbs and nutritional protocols as well. So
So how do you treat the Lyme disease?
yeah, so in where I currently am seeing patients in Massachusetts, I'm in a more of a supportive role as a naturopathic doctor. So we don't have any prescription rights. So I'm not doing any prescribing. I always coach when I do talks or when I'm coaching my patients or clients. I always let them know, so the general good rule to follow is you want to start on the antibiotics within 72 hours of any symptoms that are coming on it. Either you live in a Lyme endemic area, or you were out hiking on one of the the Pacific Trail or Appalachian Trail, or that's a common one where people kind of come back from a long hike, or backpacking trip, and then they are just really have a high fever and are just extremely fatigued and not getting out of bed. Any kind of extreme flu-like symptoms that are happening in the spring, summer, or fall really can be Lyme disease or one of the other tick-borne illnesses. So you want to start on the conventional treatment right away, and it's usually the integrative approach that I find works the best for acute cases. And usually I'm using also a lot of different herbs and homeopathic remedies and other supplements to kind of help support the systems, because the course of doxycycline that usually is recommended according to the ILADS group, which again is the International Lyme and Associated Disease Society, is 6 weeks, which is a long time to be on that. So you want to make sure you're doing a lot of probiotics. You want to make sure you're supporting your gut health and your organs. So the herbs actually do work as anti-spirochetal, which is the bacteria, the type of bacteria that is transmitted with the tick bite. But a lot of the herbs are also supportive, and they help decrease any side effects from being on those antibiotics for a long time.
Oh, that makes a lot of sense.
Yeah,
Like
they work synergistically. Yeah, and there's studies showing, for example, like Chinese skullcap really helps the doxycycline work better. So there's a lot more research coming down the line about all of that. So for acute things, it's a little more obvious. And then, unfortunately, a lot of people do not get treatment within that 72 hours. I think one of your questions was how to, how do you diagnose Lyme disease? And if anybody's familiar with some of the tests, there's a lot of false negative tests, which means that you can basically take a test for Lyme disease and it'll say that it's negative, but it's actually not negative, which is, really hard. And then also one of the main tests that's used conventionally and also non-conventionally is the Western blot, which is basically like a series of proteins that are tested, and you're testing your antibodies, but you don't produce the antibodies until 4 to 6 weeks after you've started to have the infection. So if you see you need, it really should be based on the clinical picture. And so for a lot of people, it's getting better, but even still, like today, primary care doctors and even infectious disease doctors are not people aren't getting treatment soon enough. And so basically it gets harder and harder to treat the longer. There's a lot of people that I see that have not been getting the treatment they should be getting and have not been on antibiotics now maybe for months. They've had symptoms for months now, and they're just getting worse and worse and becoming totally different things. Yeah.
The initial symptoms being kind of sort of a spectrum of possibilities. The initial symptoms just not being like real cut and dry is a problem then.
Yeah.
People might think they have the flu.
Right. Yeah.
Or but like you're talking about with the lady with the back pain,
Right. Yeah.
Sprained her back in the garden.
Right. Yeah. So because people aren't necessarily getting treatment when they should be getting it, they're not getting it soon enough, you really have to be like your own patient advocate. And it is good to know what to ask for. It's good to do your research before even sometimes calling your doctor, and within that, so a lot of people aren't getting the treatment, and what that means is that they're sort of just becoming more and more, they're just getting worse and worse and worse. And then, there's sort of different stages of Lyme disease, where it's like the first stage is what we call like maybe more acute or superficial, when you're having like the fever and you're having more like rashes and things are a little bit more on the surface. But some people go right away into like, severe neurological symptoms and not talking. And like, those are sort of like, it can go all the way to, look like symptoms that are maybe more related to autoimmune neurological disorders, like lupus or MS or things like that, multiple sclerosis. So, yeah, so it's a whole different kind of treatment approach when someone has not been getting treatment for months at a time. And also there's some people that have been on antibiotics for months at a time at that point. And usually my approach is more just focusing on, okay, where is the health in the body and where can we bring more health to the body? So I'm looking at the body systems and organs. And if you want, I can actually, I was thinking I can bring up my visual. It might be a little bit easier that way.
Oh, yes, that would be great.
Yeah, let me see. I can share that with you. Okay. So, first, of course, I would be kind of seeing somebody for a consult. And within this sort of pathogen and imbalance testing, there are a lot of people that never have gotten tested for tick-borne illnesses, like the other ones I've mentioned besides the Borrelia burgdorferi. And so that would be kind of working with your primary care doctor, or I work with a specialist and get people the testing that they need, or just kind of, again, looking at the clinical picture to kind of identify what else might be going on and what needs to be treated. But these are all different steps that we could potentially do. And if you see, there's not really one that's like a large antimicrobial therapy, whether it's pharmaceutical or natural. And, sometimes a lot of times people do need a antimicrobial therapy, but when there's a more chronic situation going on where, you've been sick for now months at a time and haven't gotten treatment or getting the wrong treatment, there's a lot of inflammation that is developed. And so that can cause a lot of damage to different tissues, can cause scar tissue. So no matter how many antibiotics you're giving or antimicrobials, whether they're herbal or pharmaceutical, they're just not going to work. And sometimes the nervous system is so debilitated at that point, or maybe your organs aren't working as well, like your liver or your kidneys. Maybe you're not detoxifying properly, that you just wind up overloading the system more with antibiotics, and they just don't really work. I feel like they don't really work very well after 6 weeks. And, for some doctors, that's like the main tool that they have. But here we're looking more like, how can we boost the immune system? Can we decrease inflammation, optimize the digestion, and calm the nervous system? There's a huge, piece of trauma for a lot of people with Lyme and not getting treatment soon enough. So emotional reset is a big one. And then, eventually we get to the point where there's less flare-ups and you're feeling like you're getting your life back and you're feeling more vital. And this is obviously a longer process.
Yes, I'm
Yeah.
sure it's so relieving for people when they are actually able to get back to kind of a normal way of life for themselves.
Yeah.
This,
Yeah. It can be, yeah, depending on how long someone's been sick for, it's usually at least a year of working together. For some people, it's longer than that. And there's different sort of phases of healing within that, where it's like you start to feel like more vital and more energy after 3 to 6 months. And then, there's sort of different things that we work on, like the digestion maybe, or the nervous system, with a lot of different, tools in the toolbox, whether they're herbs or supplements or nutrition, like a anti-inflammatory diet, and other things as well that, normally I would be doing and trying to figure out within the COVID stage. Okay, because I usually have people on in the sauna and using other tools. And so we're trying to figure out if we're still going to be able to do some of those things. But
I see.
yeah.
See. So, what is your favorite kind of patient to work with, in terms
Um,
of, you know, like how would somebody know if they would be a good fit with you, or if, you know, who do you really like to work with?
yeah, that's a good question. Um, well, let's see. I really work best with people who feel like they're, have tried a lot of different things. They feel like they've been to a lot of, doctors, and they've tried a lot of the conventional approach and are looking for something different, looking to
Mm-hmm.
try something new. People that are open to changes. I do, in the work that I do, there is a lot of food and lifestyle changes. And we kind of work deeply on all different aspects of life. So let's say somebody who's open to change and transformation, um, and somebody who is, willing to try different things, and obviously somebody who's willing to work with herbs and not on the pharmaceutical approach. So
Mm-hmm.
typically, it's easy. I do prefer working with people in the earlier stages of Lyme disease and earlier to intermittent, because it's easier for everybody who can get a lot more done that way.
Right.
And yeah, typically kind of working with people of all ages and all genders within that.
Mm-hmm.
Um, but yeah, I also work with people who have been on antibiotics for a while and sort of just feel like they've reached a plateau and they're not getting anywhere. And then sometimes I'm also helping people with the recovery phase, where maybe they've been on antibiotics for a while, or they've been on some heavy Lyme treatments or protocols, and they're kind of ready to, just focus on like healing the gut. Maybe there's a lot of digestive issues after being on antibiotics for a long time, or maybe the nervous system is depleted. And so kind of that focusing more on that like recovery phase of things, which is really important.
I see. Sure. And then my last main question for you is, uh, I know that you're located in Massachusetts, but uh, can you work with people in, say, Oregon or Washington or Iowa, or, I mean, who can you work with?
Yeah, I mean, I can work with anyone in any state and any country, especially now with telemedicine more easily available to folks. I can do video consults. Sometimes I just do phone consults with people. We don't have to do video, but yeah, it's all much easier and more accessible now for people. And but yeah, I can work with anybody from anywhere.
Oh, that's great.
Yeah,
That's wonderful. So if
yeah.
people had had questions about Lyme disease, or if they themselves have been diagnosed or have think they might be suffering from it, you would be a resource for them through the telehealth or by phone, really no matter where they lived.
Yeah, definitely.
Okay. Oh, that's
Yeah.
great. Um, can you put your contact information up?
Um, let's see what I can do. Yeah,
And
I
maybe you
can
can.
offer a free 15-minute consult to anybody on a discovery session for learning more about, what I do and how we would work well, if we would work well together. So I can
Oh,
show
that's
you that.
great. I'm so
Yeah.
excited to have for people to have a resource, because I do know, people around here who have suffered and are suffering from Lyme disease, and it's really rough on them. So
Yeah.
this is your contact information.
Yeah, so this is the website, which is cedarroseheals.com. And if you go to appointments, let me move this a little bit out of the way. So this is the phone number here. There is a contact form on here on the contact and hours. If you want to send me an email, that would be great. You can also book a free 15-minute consult here. And so you would go there and you would pick a time. So let's say you wanted to pick, Thursday. You would, put all your information in here. If you're not a patient, you just have to, you know, enter some information and pick a time, and then you get a reminder for that. And I would
Okay.
give you a call. I'm doing all this by phone, so I'd give you a call at that time.
Oh, that's great.
Yeah,
Well,
and I will
Dr.
show you too. Sorry, I just wanted to show you this one here. Oh, that's not the one I wanted to show you. If you go to services and Lyme disease, I do have my visual on here and my webinar if people are interested
Oh,
in
that's a
looking at
great
that.
resource.
Yeah, yeah, and
Oh,
it's not. It's like,
wonderful.
yeah, yeah,
Lovely. Well, thank you so much, Dr. Eisenheim, for talking to us about this, and just really looking forward to people being able to get help with their Lyme disease.
yeah.
So,
Definitely. I'm glad to have been here and glad to be a resource for folks. And I just wanted to share too briefly before we end that I did actually first start learning about Lyme disease and naturopathic treatment when I was at the school at Bastyr University in Seattle. So when I was at, in the West Coast, there's a lot more just because naturopathic medicine is so much bigger out on the West Coast. There is actually a lot of resources out there, and I learned a lot that's where I started learning. So
oh, that's great.
yeah,
Super great to know. Good.
yeah,
Resources around and help for people, and I mean, it just sounds like a truly awful way to have to live.
yeah, it can be, and that's the hope that I would like to provide for people, that there is another way, and you can do something different to heal from it.
Oh, that's so great. Well, thank
Yeah,
you.
yeah, good to be with you.
All right. Well, thanks everybody for watching, and we'll talk another time.